Hey everyone, Brian from the PT channel here to talk about how to be successful in home health physical therapy. Now, a couple things about home health is it gets a bad rap, but it's actually very fulfilling and rewarding as a physical therapy career. Now, outpatient, orthopedics, hospital, skilled nurse facility, home health, inpatient, a couple different areas to really work in physical therapy. And home health is a very lucrative one, a lot of job flexibility, you control your hours, good pay, and actually great pay. First and foremost, some things that you'll need, as you can see, a myriad of things that I have here. First, cell phone. You're going to get calls or emails from your agency that you're working for. That's first and foremost how you get referrals. They ask you usually how you really want to, if you want to take the patient or not, what's the area that you want to work in, and different cities and different environments. So you can control the radius that you're working in. It's great. So you can do it part-time, full-time, PRN, see a couple patients a week, a month. And that's really what you can do, because there's only going to give you, they're going to give the patients about 2 to maybe 10 visits maximum of home health. And then they kind of plateau and they want to go to another center or facility, like an outpatient center or just some other setting, or people get sick or something happens. These aren't the most agile, healthy people in good standing. Health really is an issue with these people too. They have a lot of comorbidities, they're weak, they're deconditioned, and they fatigue very easily. So cell phone, obviously we all have that nowadays, so it's very important to have. A planner is next, like that. So I got a blank page with some patient information on here too, so I want to make sure that we don't see that, of course. But it's just a general planner that you write patient information in it with that. So calendar, dates, times, addresses, phone numbers, diagnosis, how many visits you're going to get. Organized, stay organized first, and the best thing to do. Then you need some gloves. Some people live in some pretty filthy and dirty conditions on there, so you want to stay health conscious. Make sure you're controlling the environment. Wash your hands, get the alcohol, the little travel size rubbing alcohol, or the gel to kind of help cleanse your hands, even if you're using gloves or not. So you want to stay clean hands. Now this guy I picked up on Amazon. It's pretty awesome. It's a blood pressure cuff and it gives you a pulse. So it would go on the wrist and you put it here. I don't know if it's really going to read. And then you put it on your heart and you push the button and it's going to read your blood pressure on there. So it's going to read the blood pressure as we're taking it right now. Might as well just keep it going. You want to keep it on there, and the blue light knows that it's right. If it's orange, it's not right, it's not a good spot. So they have to keep it pressed up against their chest for a certain amount of time, and then I'll read the blood pressure for that, and it also gives pulse. So I use this for blood pressure and pulse for all our patients, because you got to take vitals to make sure they're stable to do therapy. So taking vitals is very important to take. So you're going to have to take vitals in the job. So I got a good blood pressure here. It's 100/66. So it's a little low for me, but it's actually pretty good. And pulse of 77. So do that. It comes in a nice carrying case. Just put that in here. Put that in our bag to get all organized. Put it in there. So we get that. Then we got I got my extra large gloves, because these hands aren't going to be fitting there. Next is a gait belt. Most of the time you see a white gait belt, but I got a blue one to stand out and make sure ours are different from in PT school, so I just kept this one. So a gait belt for safety. If someone's dizzy or lightheaded, make sure with that. Organizer that. Pulse ox. So this goes on your finger. You turn it on just like that. You put it on your finger in there, and it'll read it as well. So it comes in a little travel case, like in there. You can put it around your neck, put it in there. It takes a little bit of time for it to read, but so my pulse is 83 and my oxygen is 97. So sometimes hopefully as we go, it changes a little bit. But so it gives you a little marker. You can use it, put it on the ear or the finger, because it reads it through the fingernail. Put that in for you. Next, temperature. Very important to do this on the forehead. You push the button, take the temperature just like that. You can use the ear as well, but you would hit the button, do that, and then you would read it, take the temperature just like that. So, and it reads it, pretty simple. I'm going to just put that away in the carrying case. I've got to keep it all organized in the carrying case so it doesn't get all dirty. Next, I use a notebook as well, because a notebook helps me write different things in here. So I can write the date, the initials of the patient or so. There's no patient identifiers that you can do that. I write blood pressure, all that, because I use computerized documentation. So I write everything note-wise that way, because I can't use the computers in the people's homes because they don't have Wi-Fi, can't connect and everything. It's kind of tough. So I write all my notes down there and then transfer it to the computer later. And last but not least is a folder with exercises and other documentation that we need. So folder, notebook, calendar, organizer, all that. Bag, keep it all organized, and there you go. Now for salary wise, you're looking at probably getting about $70 for evaluation and $65 for a treatment. So it's very lucrative to get $70 per visit, or $65 if you're treating, times how many patients you get paid per visit. There's no salary with it, it's paid per visit. So you can see a bunch of patients make tons of money, and that's just simply put that way. So as always, guys, like, share, subscribe, and all that good stuff. Post comments if there's any other thing you have questions about or think we should do a video on, let us know. And as always, thank you.